Hi, good afternoon, everyone. I'm Ashley Koning. I'm the Assistant Research Professor and Director of the Eagleton Center for Public Interest Polling here at the Eagleton Institute of Politics. Our center, which is also the home of the Rutgers Eagleton poll, has quite a legacy in the world of statewide polling. We were established in 1971, and we are the first and longest continuously running university-based statewide public opinion polling operation in the United States. We're now celebrating over 50 years, over 200 public opinion polls on the state of New Jersey alone, and over 1,000 press releases and reports on survey data, both state and nationwide. Our mission is to provide scientifically sound, nonpartisan information about public opinion, and ECPIP conducts research for all levels of government and nonprofit organizations with a public interest mission, as well as college and university-based researchers and staff. This event today that we're so lucky to have is also co-sponsored with the Eagleton Institute of Politics Miller Center on policing and community resilience. The mission of the Miller Center is to assist vulnerable communities, particularly communities of faith, to enhance their safety and their standing in society by improving their relationships with law enforcement, with other government agencies, and with other vulnerable communities. I now turn to our esteemed colleague, a frequent research partner of mine, and of our polling center, and our guest, Dr. Mike Anestis. Dr. Anestis is a clinical psychologist, the executive director of the New Jersey Gun Violence Research Center, and an associate professor in the School of Public Health at Rutgers. He is the author of approximately 200 peer-reviewed scientific articles, as well as a book entitled Gun and Suicide: An American Epidemic. His research is focused on suicide prevention in both military and civilian populations, with a particular emphasis on the role of firearms. In its first 5 years, Dr. Anestis' center has already made quite an impact on such a crucial issue area. The New Jersey Gun Violence Research Center was founded in 2018. Its mission is to provide high-quality, multidisciplinary research on gun violence, causality, and prevention, and translate this research into clear and actionable policies and programs, therefore creating safe and healthy environments. The Gun Violence Research Center aims to achieve this mission by partnering with local, state, and national experts, accessing data to conduct research that identifies factors involved in gun violence. This initiative will help develop interventions to reduce gun violence and translate science into effective programs and policies to ensure their widespread adoption. As I mentioned, we are so fortunate to have Dr. Anestis here today to talk about this important topic, and so fortunate to be able to often partner with the Gun Violence Research Center on producing data on this topic. The following program will be a 45-minute discussion regarding gun issues and public health, followed by a 15-minute Q&A to close. Please remember, of course, to use the chat box to submit any questions. Dr. Anestis, thank you so much for joining us today. Let's start with the rise of gun violence across the nation, including the string of shootings that we've seen recently in Tennessee, Missouri, and Alabama just within the past week or so alone. There's evidence that the trauma of gun violence in the United States is taking a collective toll on the nation's mental health. In fact, a recent CNN article said that research published this year suggests that the negative effects that mass shootings can have on mental health may extend beyond the survivors and community directly affected to a much broader population. Do you think gun violence has become an American public health crisis? And what are some of the wider implications of gun violence across our communities? And which communities might you think be affected the most?
Yeah, absolutely. So, I think gun violence has been a public health crisis in the U.S. for decades now. So I don't know that it's a shift. I think that we are just unfortunately jarred into remembering what a crisis it is on an almost weekly basis as we hear about these big stories like the shootings that you just mentioned. The larger implications are huge. So, on an individual level, the folks who are injured or killed, obviously, there's massive health impacts there. The folks who survive a gunshot wound have decades of physical and mental health difficulties ahead of them, but also the impact that has on their family members is substantial, and the impact that has on the community more largely, right? A very strong argument can be made that some of gun violence is perpetuated by our failure to invest into specific communities, but also think about the investment or disinvestment that follows frequent shootings. It creates a cycle, a feedback loop that's hard to get out of. You asked about which communities are most impacted by gun violence, and it really kind of depends on what you mean by gun violence. So, we led in today with a discussion of these sort of public mass shootings or the public tragedies like we heard about in Nashville and other places, or Tennessee and other places over the last week or so. But it extends beyond that. Gun violence is characterized by community violence we see in our cities from day to day to day, stories that don't make the news very often. The bulk of gun deaths in this country are suicide deaths, which also don't make the news very often. But each of these types of gun violence impact different communities most disproportionately. So the shootings that are happening across communities are really, the burden is in remarkably disproportionately borne by Black and Brown communities across the United States. It's horrific the extent to which a young Black male has greater odds of being a gunshot victim than same-aged white peers. It's an unacceptable burden within those communities. On the suicide side of things, you see this happening more often among men, amongst middle-aged and older men, amongst service members, veterans, law enforcement, a variety of communities that are often suffering in silence and then representing a much higher percentage of our suicide deaths than they represent our population.
Yeah, you actually touched upon my next question. I know a lot of your work deals with suicide in both military and civilian populations. You also deal a lot with looking at the subpopulation of firearm owners. Can you comment and talk a little bit about your work on suicide prevention, both among military and civilian populations?
Yeah, sure. So I think that, I alluded to this a moment ago. A lot of people aren't aware that in any given year, up to 60% or even a little bit more of firearm deaths in the US are suicide deaths. And similarly, people aren't aware that in any given year, typically about half of all American suicide deaths are firearm deaths. And in fact, this past year, 2021, the most recent year we have data for, there was a 8% increase from one year to the next, resulting in 55% of all US suicide deaths being the result of self-inflicted gunshot wounds. So it's these topics of gun violence and suicide are really sort of intertwined with one another. And you see the impact most heavily amongst communities that are characterized by having a lot of men, by having a lot of firearm owners, by having lifestyles that either professionally or for other reasons encourage firearm access and use. And so what my work has done is been, on the one hand, to understand risk. It's important to know, who's vulnerable and why. But I really like a lot of my work to focus on what can we do about it, right? So I don't like to paint a dark picture and walk away from the story. I think there are tools we can use, and there are a couple in particular I'd like to mention quickly here in terms of characterizing the work that I myself have been doing and my team has been doing in this space. One of them is on interactions or interventions called lethal means counseling. And so these are just one-on-one conversations where you talk about secure firearm storage with folks. And the idea here isn't ban the Second Amendment or say guns are bad or everyone must get rid of their guns. It's to say, look, you've chosen to accept a certain amount of risk in your day-to-day life by having a firearm in your home. The same way I accept risk by getting in my car every day, right? But we can lower that risk by storing it more securely, storing it unloaded, separate from ammo, in a locked location like a gun safe or a lockbox, or with a locking device like a cable lock or a trigger lock or a clamshell. And you can store it legally away from home during times of stress. And so lethal means counseling is an intervention where you work with a firearm owner within their value system to say, okay, given what you own and why you own it in your life situation, what are the circumstances in which you might consider sort of moving along the spectrum of safety? And we've worked with extremely sort of communities you might not expect to be open to this. So for instance, firearm owning members of the Mississippi National Guard, and had tremendously strong results and long-lasting results from a single one-time conversation where we had some cultural humility to us. We look through the lens of the person we're talking to. We don't look from above as the expert and say, do this. We say, what might you do? Under what circumstances? What you find is a lot of common ground and movement. The other piece of this puzzle of what we work on in this intervention idea is public health messaging. So we've made a lot of progress in areas like, for instance, auto fatalities. Now, a lot of that's due to technological improvements of vehicles, right? There's lots of things we've done, but one of the things we've done is make it less socially acceptable for people to drive drunk through messaging like friends don't let friends drive drunk, or buzz driving is drunk driving, right? There are all sorts of messages we've done that have been persuasive and compelling to folks that maybe make them think, I should have a designated driver. I should maybe not drive right now. My team does a lot of work to try to understand, well, how can we message ideas on secure firearm storage? What we know is that the folks who die by suicide using a firearm, they're less likely to seek out mental health care. They're less likely to attempt suicide by any other method before their death. They aren't going to tell you about their suicidal thoughts. So I need an intervention that reaches them without them telling me that I need to reach that individual. So understanding who can message this, what they should say, and where that message should be delivered can help us reach these communities that are sort of hidden away, out of view, but which represent a really, really sizable chunk of the folks most likely to die in the coming years. And so I spend a lot of time thinking about how to work with and reach folks who maybe view the world differently than I do, but also aren't interested in themselves or their loved ones being hurt or dying.
Yeah, that's absolutely fascinating. And you talked a little bit about, or actually rather talked extensively about the firearm owner population. Should we know anything, or can you give us a little brief overview, either nationally, statewide, or both, in terms of, who are they? I know you talked a little bit about them being white males, but also, what is the prevalence of best practices among them? Are they practicing best firearm storage, or, what is the state of firearm storage and practices right now among that population?
Yeah, sure. So if you look nationally, historically, yeah, firearm ownership is often a white male thing, but it isn't only a white male thing. And in fact, there's compelling data, particularly from some groups out in Massachusetts and down at Johns Hopkins, showing that the demographics of firearm ownership have changed. So starting in early 2020, there was an unprecedented surge in firearm purchasing. And what we've seen is that the demographics of firearm ownership has shifted, so that half the folks who have purchased during that time and became new firearm owners identify as female, 20% as Black, or 20% as Latinx. So you see more people of color, more females purchasing firearms. And so who owns a firearm? Well, it might be changing a little bit. Is it still mostly white men? Sure. Is it only? No, not at all, actually. Now, the second question, though, is what are folks doing with those firearms? Are they storing them securely? And sadly, the answer is generally no. So if you look nationally, you find often a majority of firearm owners endorse storing at least one firearm loaded and unlocked, whether that's on a bedside table, in a closet, under their pillow, whatever it would be. You see an increasingly high number of people storing firearms in their vehicles, which are then prone to theft and trafficking and subsequent use in crimes. So you see a lot of sort of unsecure practices, and we can talk later about why that might be. Within Jersey in particular, though, we partner with you guys and collected some data, a representative data set of Jersey just this past summer. And we found a couple of things that I think were notable. In our survey, it was about 1 in 5 Jersey residents said they live in a home with a firearm. And that's higher than most Jersey firearm ownership estimates are. And that could be a couple of reasons. One would be because we asked about access, not ownership, right? So do you live in a home with a firearm? Doesn't mean you're the firearm owner, right? And I think it's more about access than it is about ownership. Just because you don't own the firearm doesn't mean you can't pick it up if it's right there, right? So that's one of the reasons why the estimate might look a little bit bigger in Jersey, still lower than most of the US, where it's 30 to 40% of households have firearms in them, but larger than what you typically see here. On the flip side, on a positive note, in Jersey, at least off of this survey, which again was some pretty compelling data, folks generally were safer with their firearms in Jersey than they are in most other places. So we are seeing an increase potentially in firearm access, although that's not longitudinal data. Let's, tap the brakes on that a little bit. But I am at least encouraged that relative to other states, there's a lot more secure storage, but we're still seeing sizable minorities of Jersey firearm owners storing firearms loaded, storing them unlocked, storing them in their vehicles, things that are leaving themselves, their family members, their communities vulnerable to injury and death because simple steps were not taken to make sure that firearm was more secured.
Yeah, I thought, you make a great point about the report that GVRC released off of the data we collaborated on, where it was almost this dichotomy of New Jersey firearm owners are on the whole, they're being safe, but the rest, the plurality of the rest of that portion were the never doing this, or I don't do this, or I keep it in storage. And so it wasn't even in between. It was a very kind of extreme, either you do or you don't. Which is, a fascinating thing. You mentioned 2020, and I think we use the word unprecedented, or at least I have so many times in the past 3 years. And, the past few years have been unprecedented. We've had civil unrest, social injustices, hate crimes, police violence, historic elections, and of course, the COVID-19 pandemic. You touched on this a little bit. How have these events influenced the purchase of guns?
Yeah. And so, look, we don't know nationally exactly how many firearms are purchased. There is no registry. So there's always estimates that go into this. But we use the same estimates now that we've used any other time. So I still think that equips us to speak to the extent to which purchasing patterns are or are not sort of historically unprecedented. And I think in this case, you can say fairly conclusively that they were, especially in sort of mid 2020, around June, July, when it really truly peaked. But to give you some context, in Jersey, the state police said there was a 332% increase in permit requests for purchasing firearms in 2020 relative to 2019. So we're talking blue states, red states, anywhere in between. And we're talking massive increases, not, this went up by 5%, which is not meaningless in a nation where there's more firearms than people. We're talking, by multitudes, these purchasing patterns were going up. And it's not that there's never been a surge before. Purchasing surges happen when folks believe there is going to be a new group elected that might pursue what would be called gun control from some perspectives. Following mass shooting events, actually, purchasing surges tend to take place, I think, presumably because people assume, well, they're probably going to do something, I better get it while I can. You also see a lot of supply chain concerns pushing purchasing surges, but nothing is compared to that 2020 surge. And as I was alluding to earlier, what's interesting about it is that it seemed to be different communities of folks purchasing, folks who in the past maybe would have considered, but ultimately wouldn't purchase a firearm. In that stretch of time, it was a different group of folks. And what stands out to me as a suicide researcher on this front is we published a couple studies on this. Historically, if you have a firearm owner and a non-firearm owner, neither group's more likely than the other to think about suicide, which is good. But unfortunately, folks who purchased during this purchasing surge, especially if it was their first ever purchase of a firearm, are more likely than anyone else in the country, firearm owner or not, to have had lifetime, past year, or past month suicidal thoughts. 70% had thought about suicide in a lifetime, 1 in 4 within the past month alone. And so you're seeing, again, I think decisions about firearm purchasing being made in the context of all the sort of chaos of those years they represent different decisions that would have been made outside of that context.
Yeah, wow. I think, and we've kind of danced a little bit around this, and this is your specialty and my specialty combined. Do you think that we've conflated health and this public health crisis with politics? Do you think we've conflated the issue of guns? And I mean, there's so many subtopics within this. Can we look at gun deaths? Should we be looking at them as an issue of public health? And where does politics all come into play with this?
Yeah, absolutely. I mean, I think that I don't see an argument that you wouldn't look at gun deaths as an issue of public health, right? This is something that on a population level is causing injury and death and financial implications and trauma, and it's impacting certain communities in a devastating and long-lasting way. And there are sort of population level interventions we can do to help with that. It's the perfect example of a public health issue, right? And the type of issue that we've made great progress on in other domains, but not so much here. And I think part of that is based on what you just asked in your question. It's been politicized in a way that's made it difficult. An example of that is that the firearm lobby basically caused the creation of the Dickey Amendment in the 1990s that resulted in essentially a quarter century of no federal funding for gun violence research, which is absurd, right? There's now millions of dollars coming from NIH and CDC, which is good, except that gun violence research gets about 1% of the federal funding that sepsis research gets, despite causing the same number of deaths, right? So progress, absolutely. Substantial progress or sufficient progress? No, not so much. And I think part of this is that the loudest voices in the room on any side of the political spectrum aren't representative of the bulk of voices in the community, right? I talk to firearm owners all the time. There's a lot of support, not just for policies and legislations, and there's a lot of room for that, and I know we're going to talk about that later, but also just sort of the ideas of things like secure firearms storage and responsible firearm ownership. There's a lot of room. Nobody's wanting anybody to get injured or to get killed by firearms, right? The question is, what's the role of firearms in society, and how should we sort of determine what people do with those firearms, or whether they get those firearms or keep those firearms, right? And the issue is there's such a powerful lobby on this, and there's so many politicians who are beholden to those louder voices that the conversation gets skewed. And so it makes it more difficult. And I think that, professionally speaking, the best thing I've ever done was spent the bulk of my career living and working in South Mississippi, where it's a very different perspective than Jersey, right? And you have a greater opportunity to live amongst and interact with firearm owners and learn to speak about this in a way that isn't waving a strong political flag. And people are entitled to their political views, whatever they may be, and to whatever actions legal that they take. But to be productive in this conversation, you can't be alienating the people you're trying to work with, whatever side of the aisle you're on. And I think that the politicization of this issue has sort of rendered most of the loud voices sort of unaware of the extent to which they end up in echo chambers and alienate one another and push one another further apart.
Yeah, and we know, obviously, as you pointed out as well, public opinion shows there is great support for gun control and, on a number of gun issues. And, we see this huge disconnect, as someone who looks at public opinion, a huge disconnect between the policymakers and what public sentiment actually is. I actually wanted to, you brought up incredible points about how to talk to people and how to maybe find commonality. So I actually want to jump to a question. You and I both know how much words matter, how you phrase things matters, especially when it comes to this issue. So how should we be talking about this? Does certain messaging help us unite and find commonality when it comes to gun restrictions and regulations?
Yeah. Well, I mean, one thing I would encourage, there are some phrases we're used to using in the sort of health space that I think might cause some trouble. One of them would be gun control or restriction, right? Undoubtedly, some legislation is in place to restrict access. That's true, but it isn't about controlling guns. Like, what we're looking for is firearm safety. And so I think that in terms of choosing words, first of all, you want to avoid anything that's creating a sort of us versus them, other sort of dichotomy, right? These are all folks, firearm owners or not, who are invested in communities being safe. They have different views on how to accomplish that. And that's an okay thing in a free society with free speech, right? And so the idea then is, okay, well, what policies or procedures do firearm owners and non-firearm owners see as likely to lower the odds that people are going to get injured or killed by firearms? The obvious one is, what if there weren't firearms? But there are. Look, there's 400 million firearms is the upper level estimate of how many are in circulation right now. There are firearms, and they aren't going anywhere. So the question isn't about banning the Second Amendment or overturning that. Where would the firearms go, right? So it's about understanding, look, you see the world differently than I do, but we also see a lot of things similarly. What are the steps we all agree might work? And most importantly, which of those steps have data behind them showing that they actually would work? And speaking in that way, speaking in a non-judgmental way where you hear and see perspectives beyond your own is the way to do this. And I just don't think there's a whole lot of that happens. I think there's a lot of posturing and there's a lot of well-intentioned alienating conversations that happen. But I think there's not enough folks stepping back and thinking, if someone spoke to me the way I'm speaking to or about them, how would I feel about that? Probably not great, right? And so I think some self-awareness is what's key in this, and some humility. And I mentioned that when I was talking about our lethal means counseling intervention. I think it worked because we didn't come in and tell people what to do. We heard people and met them where they're at and talked about where things might change for them if the context changed a little bit. I think that the most common reason people own a firearm is for protection at their home. They want to keep themselves, their loved ones, and their property safe. That's not an unreasonable thing to want, right? And so helping folks find a path that doesn't have quite the risk profile that having unsecured firearms all over the house would have is a reasonable conversation to have. And it's a different one than saying guns are bad and so are you. And it's tough because I understand, yes, that tool causes a lot of carnage that impacts our lives, undoubtedly. But if the goal is to reduce that impact, then we have to do it in a way that's going to produce that outcome. And that involves being careful with your words and careful with your tone and careful with the extent to which you come to believe you have all the answers.
I mean, you've taught me so much about jargon within this area and the proper way to phrase things, or a better way to phrase things. And in fact, this was something on our summer collaboration that we had actually looked at. I mean, as a pollster, the typical question is always, do you support, gun control, or do you support gun owners' rights? And that's a question that is widely used. And we found that when we replaced that gun control phrase with, policies that limit who can access certain types or require firearms to be stored in certain ways, we actually saw opinion leveling out a little bit overall. But perhaps most importantly, we saw Republicans actually more than doubling the preference for limitations, and that partisan divide really, decompressing when we looked at it within the framing of a much less stigmatized way of talking about for lack of a better phrase, gun control. So, we saw right here in New Jersey, even where, we often differ from the nation as a whole in terms of our opinions and behaviors. We saw how well it worked among Republicans in New Jersey, and the impact that had. And let's talk a little bit more about guns and politics. And you had mentioned gun advocates and the overwhelming share of voice that they have, and how this minority has kind of become the majority, or at least the loudest voice right now in politics. After looking at things like the loss of Donald Trump in 2020, and and that sparking larger gun sales, and looking at political instability in our nation, and then of course we had the January 6th attack on the Capitol. Where do you see gun advocates right now? Is there any leeway to kind of message with them or work towards some sort of commonality, and especially maybe in the mental health area? What are gun advocates doing right now?
So I think there's room for common ground with just about anybody. How much common ground is going to depend on who the person is, right? I think that the most extreme voices have the not one more inch mentality, which I find confusing given the degree to which all the inches have gone the other direction, actually, historically, at least recently. But I think that there's a lot of room where you see the most discrepancy and openness is in legislation, right? I think that a component of some communities of firearm owners' identity is autonomy and freedom, and a belief that rights, not just the rights of firearm ownership, but rights overall, should not be regulated very often, right? And so if you think of the firearm as a representation of someone's identity, as this tool they use for a most sacred activity of keeping themselves and their loved ones safe, and they don't want government telling them what to do about anything, never mind that, that's going to create a real tough move, right? And then the more nefarious side of that would be, look, the folks who stand to gain or lose financially from this need firearm sales to go up, and very few of those regulations will help a profit margin. So if a well-financed lobby can also get behind and lift up that voice, it can make it look more extreme and more common than it truly is as well. So you have that sort of background in there as well. You do see some collaborations between groups like the National Shooting Sports Foundation, the American Foundation for Suicide Prevention, where they do some work about promoting secure firearm storage. You mentioned mental health. As a clinical psychologist myself, though, I get a little antsy in the discussions about mental health and gun violence, whether that's suicide or community violence. Very often the media talks about gun violence as being a result of mental health difficulties, and politicians run with that as a distraction on the impact of the access to firearm itself. And then, quite frankly, suicide, certainly folks who die by suicide tend to not be doing particularly well emotionally at that particular moment, but mental health mental health diagnoses, number of them, type of them, combination of them, are actually terrible predictors of death by suicide. They're good predictors of people being in anguish, but not good predictors of firearm suicide death. So there are a lot of folks who say we should solve this by investing in mental health. And I'm all for investing in mental health. Again, I'm a licensed clinical psychologist. Yes, invest in mental health, especially evidence-based mental health. But that investment has not much beyond nothing to do with impacting gun violence, quite frankly. The mental health investment in gun violence is about helping the victims of gun violence and their communities recover from the trauma of the victimization. It isn't about preventing gun violence from happening on the notion that mentally ill people are engaging in gun violence. They do, but not nearly as much as non-mentally ill people engage in gun violence.
That's eye-opening, because obviously that's the big one that we always hear, especially trying to divide that part, or bridge that partisan divide of, oh, well, maybe we can all talk about mental health. When we went into the field together and asked some questions about the Uvalde shooting, mental health was one of the measures in terms of whether New Jerseyans would support more resources going towards mental health, or if that would be a problem solver towards mass shootings in schools. And that was over 50% of New Jerseyans said that they believed, that would be something that would prevent mass shootings. So this is a popular topic, and it's eye-opening to see the view of, how mental health actually plays the role in reality. And you mentioned the media. I think that's a great point to make. Do you think that the media aggravates the use of gun and gun violence? Do they have some sort of role? I know we're always talking about who's responsible, who's to blame. What role does the media play or do the media play, and kind of, what could they do, or have they helped, hurt? What do you think about the media's involvement in the issue?
Sure. So I think there are a couple of areas to think about the media's role in all of this. So let's start with the mass public shootings. And it's important as a reminder, those mass public shootings that represent probably about 95% of our conversations on gun violence as a country represent about 1% of gun violence, right? That in and of itself is part of the role the media has in gun violence prevention. But when they talk about gun violence prevention, one place where they could potentially play a negative role is by focusing so much on the shooter, the perpetrator, rather than the victims. It's not that notoriety is the singular overriding goal of mass public shooters. It's not. For some, it's not on the radar at all. For some, it is, but it isn't the leading role. But it's not a nothing kind of situation. And so when the media focuses in on the shooter, and his face and his name is all over the place, that's notoriety. Notoriety is not something we want for the shooters. And so there's this pretty strong movement to encouraging folks to don't talk about the shooters, to talk about the victims. Talk about the victims. Don't give notoriety to that individual. So that's one thing the media can do that would be helpful. Another, though, as I was just alluding to a second ago, would be to make the conversation about gun violence proportional to the nature of gun violence. And that's not me saying talk about mass shootings less. Talk about mass shootings as much as we do or more, but don't ignore community gun violence. Don't ignore the impact of gun violence, specifically in Black and Brown communities, and don't ignore the data-driven solutions we have to those issues, and don't ignore firearm suicide, which is the majority of the firearm deaths in this country. If the nation doesn't know what gun violence looks like, they're not going to demand solutions to what gun violence is. If the conversation is only about mass shootings, the policies we pursue, and you see this in the policy conversations in Washington, are all going to be focused on solutions to that problem. And look, we should solve that problem. But if we ban assault weapons or ban high-capacity magazines, both of which I think make a whole lot of sense in terms of preventing those tragedies or reducing the carnage, they're both good ideas, but those will only help that 1% of gun violence problems for the most part. You're not seeing high-capacity magazines or assault weapons involved in community violence very often, and certainly not in suicide, right? So I think that the media can help create demand for solutions that help more of the victims and their communities if they make the conversation representative of gun violence in America.
Yeah, and if we talk about going back to politicians, what and you mentioned some of this, what actually would work, or what would only be solving a small percentage. And of course, we saw the decision come down from the Supreme Court. We see that, the issue of guns and concealed carry is in the courts right now within New Jersey. And so, what role should and do laws have in preventing gun violence? What should be done, and can laws alone prevent gun violence?
Laws alone can prevent some occurrences of some forms of gun violence, right? So I think that in public health, we often talk about the Swiss cheese approach, right? It's a whole bunch of different solutions, each with holes in them. But when you stack them all on top of one another, because the holes are different, you can't see through the cheese anymore, right? And so think of each of these policies as one slice of Swiss cheese. They're not going to save everything. They have some big old holes in them, right? But the other policy or the other non-policy related solution doesn't have those same matching holes. And so they cover up each other's weaknesses. And there clearly are forms of legislation that data show are effective at preventing various forms of gun violence. And so you can think about, first of all, policies that involve who can acquire a firearm or how quickly, right? So you're talking about universal background checks, but more importantly, background checks paired with licensing laws. You're talking about waiting periods that delay the acquisition of a firearm and also allow more time for the background check to actually be completed. What I don't see is evidence for legislation that says, well, don't let folks with a history of mental illness get a firearm. That's not effective. Jeffrey Swanson has shown compellingly that legislation works when it impacts the population, not when you're targeting the mentally ill. But there's also legislation that says, okay, the firearm's already in the house. What do we do about that? And there are a couple of things there that have been shown to be fairly effective. One would be secure storage laws, often child access protection laws, where there's pretty compelling data where when there's a firearm in the home and it has to be stored in a certain way, you reduce the likelihood that individuals who weren't supposed to access it will use it and end up being injured and killed. And then more recently, and what's interesting about this, what I'm going to talk about next, is you see more bipartisan appeal in it, despite sometimes voices arguing against it, are what's called extreme risk protection orders, or what some folks call red flag laws, although I'd encourage maybe not to do that because no one likes to be called red flag. But what extreme risk protection orders, or ERPOs, do is they, depending on the state, and there's currently 19 states that have them, not all blue states, they allow, depending on the state, some individuals, family, law enforcement, for instance, to petition a court with evidence of imminent risk to self or other, and that will then cause that individual to lose their access to firearms for some period of time. For some states like Jersey, it's sort of indefinite until you appeal. Other states, it might be 12 months, right? And who can do this appeal, it differs. But the idea is, look, there's due process. It's evidence of imminent risk. It's behavioral risk. It's not like, well, this person's had depression, so they can't have guns anymore, because depression is not a good predictor of any form of gun violence, right? And so these laws represent that sort of last second safeguard. And there's been good evidence that not only do they prevent suicide, but out of California, there's some data that they might be useful in preventing mass shootings. So there's some legislation that also cuts across forms of gun violence, and some that's more specific to one form or the other. But there's no single law that's going to prevent all of gun violence. And if all of our solutions are legislatively based, then we're going to fall short of our goals. A lot of this is about culture change within firearm owning communities to create greater likelihood of safe outcomes.
So you touched upon this, a lot just now, but, in an ideal world, if we dream for a second, what is the ideal public health approach to gun violence?
Yeah, I mean, I think we're still working on that, but again, it's multifaceted. So obviously, I'll start with the thing that's closest to home for me. Invest in research, right? Like, we solve public health problems by studying them rigorously over years and years across multiple independent research teams who then replicate and build upon one another's work and then test it in real world settings, right? So you have to invest in the infrastructure of study. And you have to understand, it's not just that we've been underfunded. There was no funding, which meant generations of scientists who would have been doing this work for the last couple of decades didn't happen. And they didn't train students who would have done that. So we're so very far behind. That means you have to overinvest. That's a key. And I've been very fortunate to live in Jersey, where that's the thing the state does on an annual basis. I think that this is a thing that needs to be happening federally. It needs to happen all across the country. So that's one thing. But also, I think people need to sort of, in some ways, get off their high horse, right? And work within reality. I'm a big pragmatist. There's a problem, which is that, look, we are inundated with firearms in a way that no other nation in the world is. That risk is there. We have to solve it, but you don't solve it by yelling at people. You solve it through collaboration. So doing the hard work of engaging stakeholders, firearm owners themselves, understanding who are the compelling voices who might carry this message. It's, spoiler alert, it's not me, but who it might be? Law enforcement, service members, veterans. Get those groups engaged in promoting these ideas. Think about, how do we portray firearms and storage and use in popular media? What are we modeling for folks and normalizing? We need to talk to healthcare providers about asking about firearm access regularly. We need to create situations where firearm retailers can store firearms legally for firearm owners and then not be liable when they give the firearm back. So they're not having to put their business on the line in order to do a service for the public, right? So we need to be thinking about all sorts of ways that say, look, the firearms are here and they're going to be here. In fact, more are coming. What can we do to better understand where they're going, how they're being stored, and how we can encourage people to engage in behaviors that lower the odds that these tragedies that bring all of us to this webinar right now happen with less frequency. They're not going to go down to zero. Look, as long as we're a nation that accepts firearm ownership as part of our daily life, we're going to have gun violence in a way that other countries don't have it, because other countries don't have firearms, right? We do, but we can sure save a heck of a lot of lives.
That's the perfect segue into my next question. You mentioned our uniqueness as a country. And so our director at the Eagleton Institute, John Farmer, recently penned an article about how we as a nation have ignored gun violence and COVID deaths. He talks about how the deaths of our children by gun violence is an American phenomenon. According to the Kaiser Family Foundation, firearms take the lives of 5.6 out of every 100,000 American children between the ages of 3 and 18, and no other developed nation is even close. We just had an issue in the area, and my son's daycare went on lockdown for the first time, and it was the most frightening thing I've ever experienced the other week. So, this is what we live with as civilians, as residents, as moms and dads and parents. Why do you think this is so unique as an American tragedy?
Yeah, I mean, look, to tack on to what you just said, another compelling way of thinking about what you just said is that within the last couple of years, firearms became the number one cause of death for children and adolescents in America. The number one cause of death in children and adolescents in America. That's a wild fact And I think it was New England Journal of Medicine that finding came out. It's not some obscure outlet. This is publicly available, compelling data. Honestly, this is one of the few times where I think the answer to your question is simple. Why is America unique? And the frequency with which our children and adults are being injured and killed by firearms is because America is unique in how many firearms we have. There are no other nations that are armed with personal firearms anywhere close to the extent to which the United States is. Where there are more firearms, there's more firearm injury and death. That's not a disputable stat. It's also not a judgment about the Second Amendment or decision to have firearms. It's an acknowledgement, much like where there's more vehicles, there's more vehicle injuries and deaths, right? But there are all sorts of things that we do for sources of risk across our country all the time. We all buy into the system of like, it's good to have rights and freedom, and it's also good to make sure that people aren't dying and getting hurt unnecessarily when I could do simple things to change it. And we're unique in that we are inundated with firearms, and we are unique in that firearms are a part of our identity and part of our look. Our nation was born out of a drive for independence and a drive of autonomy, and those characteristics have fueled many of the things we value most about this country. And I think trashing on those wouldn't be a good idea, because you have to accept both the good and bad that come with every characteristic, right? If you take away a characteristic, you don't just take away the bad part you fear, you take away the good parts that have given you so much, right? And there's a huge part of that should be valued. But it also, again, comes with this willingness to take on this risk that unfortunately I think it's sort of a virtue that has been perverted in some ways through marketing, through conversations that make people distrustful of data and science and cause people to lean into misinformation that perpetuates the idea that not only do you need to get firearm, I need to get more and more, and I need to keep them on the ready because someone's coming to take them and someone's coming to hurt me, when they aren't, right? And what we're doing by constantly buying more and having them as readily accessible is we're increasing the odds of these tragedies that make us so unique.
To wrap up our conversation, and everybody, please remember, if you'd like to ask a question, you can put it in the chat. We're both Jersey-based. We've done a lot of collaborating on New Jersey residents and New Jersey firearm owners. We know New Jersey is one of the states with the most stringent laws in the country when it comes to gun-related issues. What is the role of state and local leaders in preventing gun violence? We talked about the federal level, but what happens on the state level? What's important to know about the state level?
I mean, honestly, in this moment in time, I think the state level is the most important because there's essentially paralysis at the federal level. The Bipartisan Safer Communities Act is not something to sort of look away from. It's real, and it had bipartisan votes, and it's the biggest legislation to pass in decades, right? And so that's a real accomplishment, and we should sort of acknowledge those things when they happen. But that was sort of a unicorn, right? Generally what you have is paralysis, and in the context of the current Supreme Court, sometimes regressive movements away from safety and data. And so it's up to the states themselves to implement tools to keep their constituents safe. And as you mentioned, in Jersey, we're fortunate that's happened quite a bit. And I know that's not a universal opinion. Some folks feel very strongly that that's not great. And look, there's room to disagree and talk about these things. There's not really room to disagree about the data behind policies and the extent to which they're shown with reducing injury and death. I mean, those are numbers. But what's difficult about this federal versus state dichotomy is that when you look at states like New Jersey, or you look at Illinois, or you look at states where people often look at specific cities and say, "Well, look at the crime rate in this blue state," what you notice is a shockingly high percentage of the firearms recovered in crimes come from other states. So in Jersey, that's somewhere around 85% of the firearms recovered at crime scenes come from outside of New Jersey. States make their own laws, but those boundaries aren't actual walls, right? Firearms come up from South Carolina, firearms come in from Pennsylvania, where it's easier to acquire large numbers of firearms with little regulation and then to distribute them illicitly across the state. And so it's the responsibility of the states to try and find solutions and work collaboratively with one another to fend that off. But it's a frustrating sort of derelict of duty of the states that have not thought about this and have not thought about the impact they're having on their neighbors and have not done anything to manage the bad actors. There are several specific FFLs in some of these states, retailers in these states, responsible for a shockingly high percentage of the firearms recovered in other states. Not much happening to them. And so, yeah, the state's role is massive and limited.
Yeah, I think, that is something that just unfortunately applies to so many issues nowadays. And like you had mentioned before, this is part of the ingrained culture of how our country was founded. This was purposeful in many ways by our founders, and it's something we have to deal with on a number of issues just like this one. Let's go to some of the questions that we have so far. Just as a reminder to everyone, you're more than welcome to put questions in the chat. And we'll try to answer as many the best we can. All right, so first question, are there so many firearms in circulation now that it's unrealistic to expect a reduction in incidents of gun violence?
No, I don't think so. There's far more vehicles in circulation than were in the past. We've seen a massive reduction in firearm or in automobile injury and death, right? So it would be unrealistic to expect that number to go down to zero. It would be unrealistic to expect that number in the US to be comparable to nations that don't have many firearms in circulation, in Japan, where there's very, very limited personal firearm ownership. We're not going to see those numbers, right? But absolutely, you can see meaningful reductions. And you can see that for no other reason than in the discrepancies between states based on not only firearm ownership rates, but the legislation that they have in place. But you can also see that in policies that take hold in certain places. So the comparison I always give, and again, as a suicide researcher, it's just where my mind goes, but by far the most successful tool we have in suicide prevention is called means safety. You take a specific method that's frequently used and highly lethal in a specific geographic space, and you make it either less lethal or less available. So for instance, in the UK in the 1950s, the most common suicide death method was people sticking their head in the oven. And the reason why was because the domestic gas supply was so heavily inundated with carbon monoxide, people quickly suffocated and died. When they when they detoxified that gas, the overall suicide rate went down by 30-40% in the UK. In Sri Lanka, in the turn of the century, they have a problem with farmers ingesting pesticide. They banned the most lethal brands of pesticide, and the suicide rate in Sri Lanka went down by 50%. But most relevant to this question and to the U.S. situation is the Israeli Defense Force, where they saw, there's compulsory military service for young Israeli citizens. And what they noticed were that Israeli young service members were going home on weekend and holiday with their service weapon and dying by suicide. And it shifted a policy. So you have to check your firearm into the armory on weekend and holiday. And the suicide rate amongst those young service members went down by 40%. Can we do any of those exact things in the US with firearms? No. But what those stories show you is that when you take something that is prominent and lethal in a country and it's used to cause this unfortunate outcome, and you can disrupt the processes involved in taking that item and using it for that purpose, you decrease the likelihood and the frequency of that outcome. And so, yes, we can reduce rates. We can reduce them meaningfully and sustainably if we do a variety of things. We're not going to get it down to zero. But again, that's part of this nation's identity. As long as we say the Second Amendment says this is a part of our rights, then this is going to be a thing that happens. That's not saying it's okay. That's saying it is true. And so our job as a society is to limit that as much as is humanly possible.
So our next question is actually about family and domestic violence. It says, can we talk about how to address family violence and domestic violence, how it relates to public health, gun violence, and mass shootings? We found that about 59% of mass shootings between 2014 and 2019 were domestic violence related. And in 68% of mass shootings, the perpetrator either killed at least one partner or family member or had a history of domestic violence. There are significant differences in the average number of injuries and fatalities between domestic violence and the history of domestic violence shootings, and a higher average case fatality rate associated with domestic violence related mass shootings than non-domestic related mass shootings. I guess, at the root of this question, let's bring into play family and domestic violence here on top of the issue of gun violence and mass shootings.
Yeah, and look, it's worth noting that when there's a firearm in the home, the odds of domestic violence ends up being lethal goes up 5 times, and the number of victims, and then the stats citing that question align with this, number of victims goes up dramatically, right? And so firearm policy, and that's really what we're focused on here. So I'm not a domestic violence expert broadly, so I'm going to limit my response to sort of how we address this through firearms, but that is not a comprehensive solution to domestic violence by any stretch or means, right? But it's an important component, right? So in thinking about what you can do, one of them is something we did see in the Bipartisan Safer Communities Act, which is addressing things like the boyfriend loophole, right? So in a lot of laws that are akin to ERPOs, extremist protection orders. You have sort of domestic violence based restrictions on firearm access, but oftentimes that was limited to a very select type of domestic partnership, often marriages. And so what you had were a lot of domestic violence, ongoing situations where the perpetrator could still just as easily get access to that firearm. Now, even in places where restrictions are in place, you see laws not enforced, or you see people going to a neighboring state to get a firearm because they can no longer get one in their current residence, right? So you have those same limitations that are in place in terms of that federal versus state legislation we were talking about. But anything we can do to recognize that in a situation where domestic violence has been recognized as occurring, we need to make sure we have limited firearm access. If you haven't removed firearm access, we need to make sure some way or another those firearms are stored more securely. So there's at least an obstacle. But the reality is, gun violence is, when it's interpersonal in basis, is generally prompted by an interpersonal interaction that is negative, an ongoing conflict. And many of those conflicts are domestic in nature. And the reality is, when someone has shown a propensity towards violence, particularly towards people they are in relationships with, them having access to a firearm is generally not a good idea. And we as a society have to sort of invest in that as a reality.
We have another question. So, Mike, if we go back to, you mentioned this specifically at the beginning when we were talking about the most vulnerable populations. If we go back to Black and Brown communities, what are the solutions or possible solutions on the table to combat gun violence, specifically regarding youth within those communities?
Yeah, so there are a few, right? And again, we need more data to back some of these things up, but some of them are sort of outside the box. So some of the compelling, interesting data I've seen have come out of the Philadelphia area, where there's a research team that's done some research on what's called greening. And the idea is you take physical spaces where gun violence happens a lot, and there's sort of like a derelict space, and people aren't comfortable walking, there's not much lighting, and you clean them up. And not just like literally clean them, you invest, you green them up, you make them almost park-like. And what you actually see in these RCTs is reductions in gun violence in those space, and no evidence that the shootings are then just moved like 2 blocks over, right? And so some of it can be investment in the physical community itself, which can then increase foot traffic, which can then prompt other positive economic effects to happen in that environment, right? You create a place where people move around a lot. So that's one thing. Speaking specifically about youth, it's also about providing opportunities for folks to have other paths, right? So investing in after-school activities, investing in equitable access for youth to be engaged in healthy activities that allow them a path that's different than they otherwise might go down. And part of it is also investing in some of the community engaged violence prevention work that we see, whether that's violence interruption teams, like the Newark Community Street Team and Patterson Healing Collective we see across New Jersey, or the hospital-based violence interruption programs we see in Jersey and beyond as well, where a lot of times the folks involved in those groups are themselves previously involved in gun violence. They certainly know the community, but their job is to help make sure people are getting connected to the resources that they need, that they're aware of the sort of beefs that are happening within there, and help to de-escalate things. And having those sort of trusted community members involved in the conversation could go a long way, which is very similar to what I was saying before about suicide prevention as well, right? It's people need to hear voices that make sense to them and are persuasive to them, that allow them to make choices and find opportunities that aren't there. The issue with youth, Black and Brown youth gun violence, isn't that they're not looking for opportunities, that the opportunities aren't there. So much of this really just comes down to investment and providing opportunities that are equitable, that you see in other communities where gun violence is down. And then some of it is then helping folks, given the arrival of those resources, to know about them and engage with them effectively.
And then I think we have one final question, and you actually just touched on this. Is the Gun Violence Research Center doing research on these community intervention programs actively that have been started in New Jersey, the street teams, the HVIP programs, and what you had just mentioned in your previous answer?
So we're doing research with them. We are not doing an active eval of those programs, but we are funding research that is working also in other states as well. So we're working with them, and we're trying to study these as best we can. Part of it is understanding, does this work, does this not? Part of it is understanding is, what do these folks do, and what are the experiences that are in it? Who are these intervention groups coming in contact with, and understanding the processes? So we're investing in all of these things. And we were actively engaged with these groups. And we were, in fact, hosting an in-person summit in a couple of weeks where a lot of these groups we're fortunate will be attending. We'll have a chance to talk to them about sort of next steps and what do we do. But, absolutely, eval is the kind of thing that needs to happen. As a scientist, I want to see the data that what people are doing works, and not just does it work, but why does it work, so that you're better positioned to replicate the most effective components of what worked here over here. And then we increase the odds that what we're investing in is giving us the sort of yield or return that you'd want from that investment. And so that's work that needs to happen for sure.
Any final thoughts before we close out?
I guess, again, this is a difficult conversation, but it's a really important one. I just encourage people to keep having it, but to have it in ways that don't necessarily come easy, and to have it with folks who don't necessarily see the world the same way as you, but to try and have those conversations with those different folks in ways that aren't just arguments, that aren't about, let me tell you why you're wrong and why I'm right, but let's try and understand each other. That doesn't mean you will. It doesn't mean that you guys will find common ground, but it means, I think, that the extent to which we engage in this topic in a more rigorous way, rigorous not being confrontational, but being willing to go beyond our comfort zone, the more success we'll have.
And just one final question. How do you feel about the future of gun violence in our nation? I mean, I think, like you said, you're a pragmatist, and I hear a lot of positivity and possibility. So how do you feel about its future?
Look, I feel positive about the trajectory. I think that I give that answer with the caveat being that it will never be what I want it to be as long as we are a nation as inundated with firearms as we are. I think that's a reality. But what I try to do is get the best outcome in the context that I have available to me. And within that context, look, there is increased investment in research. There is increased investment in community violence groups. There are more people coming to the table to understand how this problem works. There are more collaborations between people of different political backgrounds. And we did see federal legislation pass in the last couple of years. I mean, all of that is meaningful. And at the same time, you open this conversation with a list of horrific tragedies that we all watched unfold across the nation over the last couple of weeks, and undoubtedly more coming over the next couple of weeks. And so I think I am positive and realistic about what's coming. The tragedies are coming, and my job and everyone else's job in this field is to try and prevent as many of the next ones as possible.
Well, thank you very, very much, Dr. Anestis. We truly appreciate it. On behalf of the Eagleton Center for Public Interest Polling and the Miller Center on Policing and Community and the Eagleton Institute of Politics, this will also be recorded and up on the Eagleton Institute of Politics YouTube. Thank you so much for being here.